Mark Durgan. I'm the project director for the Pennsylvania Care Partnership. And we are here today for our webinar on family-driven and the Pennsylvania Alliance for Children's Services. This is one of our monthly webinars that we do as part of our System of Care grant. Today, we've, in the past, have done some webinars on data, youth-driven, our family peer program, as well as some other various topics. So today, we said we're going to be talking about family-driven. As part of that family-driven piece is really kind of thinking about some of the how this can look in different communities, some of the technical assistance and ideas behind that, as well as engagement. All right. Christina Padnasser, she is the director for the PA Family Alliance for Children's Services. And Crystal, are you on? Not hearing you, Crystal. I think check the chat.
There we go.
Oh, there you are.
I did not the top of the screen. Sorry. So this is Crystal Krenchak. I'm the Family Policy and Engagement Consultant with the PA Care Partnership.
So welcome. Crystal, if you want to I've kind of briefly reviewed the agenda. And again, at the end, the one thing we do want to hear is just to double check to make sure that we're meeting everybody's needs. And also if there's any ideas or thoughts that you're looking for from either a county or family members' perspective on the needs for this family-driven piece, that we can look at some either additional training points or actually other ways to engage. So, take it from here, Crystal.
Okay, so family-driven at the family level. It's understanding that family level means families have, I can't see my whole screen here. Let me see here. Families have a primary decision-making role in the care of their own children. There may be some situations where they may not have the opportunity to drive all decisions, but they should have the opportunity to have involvement in the decisions. And I just want to be clear about this. When we say that families have a primary decision-making role, we're not saying families have the primary decision-making role. So when decisions are made within the team that's working with the family, it is that there's an equal partnership, that everybody has input so that decisions can be made for what's best for the family and the youth involved in that decision-making role. So again, I just want to be clear. Some people have think that what we're saying is that families have the only decision and our primary decision. So that is not at all what family-driven means. At a system level, and if you have any questions while we're going through these, please feel free to ask or type in. So at a system level, this would mean that families work in partnership, so that voices of families, those with knowledge, can be utilized at all levels in the service systems. They can be in leadership positions at their county and state, providing input into policies, procedures, and funding decisions that govern the care of all children in their communities, and that family-driven concepts can be realized even within the context of delinquency and or dependency proceedings, even when there's a feeling that is not being driven by the family. So some of these things to think about in some areas where systems are concerned and certain provisions or services they're receiving, it may be driven by CYS or juvenile justice, where the family is more at a level of involvement as opposed to engagement, because there's other factors, regulations or legislation or the judge's decision that will drive some of that. So the families, what does it look like? Families would have the option of choosing the services, supports, and providers of their choice. They're a central part of the team, and they are at all meetings. Now, they may not appear in clinical discussions, but they would be any other meeting that's being held that families would be involved. They understand and are acknowledged that they're the experts on their family, that they all feel respected, valued, validated, that it's safe for them to express the challenges and that their families have and their ideas or plans, and not feel that they're being alienated or that there'll be retribution around those discussions, and that they have the knowledge that they need so that they're prepared for every meeting. And some of this is about preparing them for understanding exactly what is available, what services, if family group decision making is being offered, what is that, and what does it mean, and what would their participation mean for their family and their child. Okay. At a system level, they would be able to choose cultural and linguistic competent support services and providers. So is the culture of the family being looked at? As well as thinking about how this are these transactional relationships or transformative relationships. So in some areas, it may be more of a transactional relationship. So there is, when I say transactional, I mean, is there a reward for either the system or the family? May it be that they're looking at gift cards or stipends or an opportunity to have respite, and that's would be an imbalance of power. And some of the systems that some of us family members find ourselves in could be that, as opposed to a transformational family-driven relationship, which means that there's a shared vision between the families and the systems, as well as the providers, that there's a shared goal and that there's shared respect. Families would be utilized in designing and implementing and evaluating programs, monitoring outcomes. They would have the knowledge they need to look at data and understand what it means. That they're at the table when funding decisions are made around with system partners, and determining and how they would help determine the effectiveness of the efforts to promote mental health and behavioral health of youth and families within their county or state. Okay, Mark. Some of the steps that we've thought about at a system level on how we can get to family driven is, of course, based in transformational, from the transformational perspective. So with counties and the state having a minimum of 25% of their leadership teams are family members who share equal responsibility with youth and system partners. Providing and making sure there's training and education to family members on the state and county level. So does your county have trainings that family members would be invited to so they understand what's going on with evidence-based practices or data or those discussions around that? And understanding what leadership means. Are they being trained in leadership skills? And how are they providing leadership at the different county meetings? And are there different levels that they can be provided? So is there other places in your county that families and youth or young adults might be a valuable voice, at least in understanding and learning what leadership is and providing their input because they're impacted by the decisions made? And most importantly, don't discount the lived experience that a family member and young adult brings and the knowledge that they bring on how these things have impacted them or what they're hearing from other family members. Okay.
Yeah, Chris, I think the one thing that I think is a real kind of, and this is in my opinion from that kind of system partner perspective, that's really important when we're thinking about and talking about this kind of training and education. That the training does not have to be provided to just family members. I think one of the things that we really kind of started to really kind of ingrained a lot more in these recent years is this idea of bringing the family members into the same trainings that the system partners are getting, so that there's the equal playing field. And I think that really does help to actually, one, is build those stronger relationships, but then also it really, I think, establishes that more equal view.
Oh, I agree. So I've never made the assumption that just because you're employed in a system, in a county system or a provider organization, that you come with all the knowledge you need on what committee work is or the role of sitting on a committee and understanding that, what is this decision-making body. So what's the difference between an advisory group or a governance body? They all have different frameworks and different responsibilities and levels of responsibility. So I'm not assuming just because you have a job in a system or in a provider agency that you come with all that knowledge. It's not to say you can't, but you may need the same training. You may need training on what a difference between a transactional relationship and a transformative relationship is, and what the difference between shared values and vision is different than something you're providing that's you both have something to gain from, but transactional relationships don't necessarily mean that they're ongoing or that they exist beyond that single relationship when both have received what they need from that. So I would agree, Mark, totally. Any questions so far? Any comments?
I don't have any in the chat box, so.
Okay. So as family members, we're everywhere. We don't hide. We may not be we tend to not be in just one system. So sometimes we have knowledge about other systems. So you can have a family member involved in mental health as well as drug and alcohol, as well as juvenile justice, that may have touched children and youth services, maybe starting down the road into moving towards the adult system or just entering the adult system. And there's that, transition process happening. It could be there's very few of us that are not touched by education. So we may be more engaged in some systems than we are others. We may be moving around levels of involvement to engagement, to empowerment in some places. Some of us want to be leaders in systems. Some of us don't. It's all okay. So, and we may have touched one system more than another, or choose to be involved in or engaged at different levels at different times with different children in many cases. So some of us, there's probably not a system we haven't touched. We're not homogeneous. We're definitely have, we also have other lives, where we go to work every day, where we touch members of the community, where we're involved in other things that we have an interest in. It's just not sitting at home worrying about mental health or drug and alcohol, although it may feel like that at times. But you may have family members whose children have been very successful in juvenile justice or had great outcomes after having been involved in children and youth services, or has been very engaged and has a level of knowledge where they're now working or helping other family members. And those are the families that you probably in leadership roles want to reach out to. And talk to each other, the different systems or providers around who has done well and has a grasp and understanding of different, what's evidence-based practices or what is a managed care organization. Many families navigate these systems and don't always know what to call them, but they've done it well. So, those are family members where you're talking about in leadership roles that are some of the places to start. Or thinking about family members who are in the systems now that may be doing very well. And so that's where you can start tapping into family members and their leadership. Or you can just put flyers out in restrooms in hospitals or in grocery stores, they may not, language. Some of us like behavioral health as opposed to mental health. So there's different ways of doing outreach to find them. And then, discuss with them what it is you're asking for them, what their responsibilities would be, how you're engaging with them, what's in it for all of us, as opposed to, like how can they help make change, and that their knowledge is valuable to you as well as to them, and how you can help others. So family members, we have a wide range. They can be foster parents you may want to reach out to, other family members who are doing care, such as kinship care, either whether it's through CYS or just family arrangements where it's not the parents. It can be, parents are biological as well as adoptive. They can be we're seeing more and more grandparents who are now doing the main care, older siblings who now have custody and are doing the caretaking. It can be aunts and uncles. We're pretty varied. It could be people who are not biologically related, but the family thinks of them in those terms. And it could be them, the ones who are stepping in, who are helping, showing up at the meetings because of family circumstances. It could be that they're doing the primary caregiving or doing the attendance at meetings because the family members who are primary caregivers may not be able to attend all the time because of job responsibilities or roles. So them are the ways to think about them, just not straight bio parents, and maybe not parents who are currently involved in systems, maybe those who have had some time away who are ready to step back in and help others. So there's different ways to think about how you're engaging families and who they are and thinking outside the box.
And this is Mark again, and Christina, obviously, if you have any comments on this, please let us know. But I think we have, from looking at the list of people who are attending this call, I had a chance to see that we have a lot of really great individuals on the call. So my request, my thought is, if you would like, and just even in the chat box, putting some of the areas where you've been able to kind of find and locate those family members in your communities. I think that what we can do is even use this as the start of this kind of live living document. We can obviously share this toward the end of the presentation of all the different places. So please, over the next couple of slides, if you have any thoughts on that, of where you found or been able to have good resources for finding and engaging these parents and family members, we'd love to hear it.
Sure. Share them with us. We'll be glad to add them to our list. The other thing is, too, sometimes it's family members that you've thought of as not always being the most compliant. Sometimes that's fear of the future for our children, fear of what's going to happen in our home. Sometimes we don't always behave as well as we should. And sometimes those families have really a lot of knowledge, and some time away from having children in the system can sometimes help us with our approach and the way we're interacting with others. So just to keep that in mind, that it could be the least likely parent, you would think, or caregiver. So to be able to build family members, you kind of want to think about how you're inviting people who have been involved, families who have been involved in the system. So are you inviting them to county trainings? Are they taking part in any of the trauma-informed care that you may be doing? Or any training around specific systems or evidence-based practices? Are members of the community invited? Because they may not think of themselves as family members with expertise, but they may want to go to see maybe they could learn something new. And that's where you sometimes will find us, that we're attending for other reasons, and then all of a sudden we realize, we could be the people you're hunting for. Can you send them to regional or state training events as you find families who may be engaged? Are you asking them to connect with other family members in your county that they could take information back to and start engaging them? So sometimes family peer-to-peer is one of the best ways to engage other family members. Do you value and respect them, even when they're not in the room? That can be hard sometimes. But, if their voice is respected, sometimes, it's first of all, we sometimes know that whether we're respected or not. So practicing when we're not around is always a good thing. Do you have mechanisms in your policies in place to provide assistance for families to participate in events? Do you provide them with stipends or reimbursement for travel? And again, that can be sounding more like a transactional relationship. So if you don't have policies written, it may be something you want to think about. It's something that doesn't go away. That families would be, several of our counties have written policies around that in the past, where if you attend a training, there's transportation costs and reimbursement for things that are covered in the county's policies. So there are things around that that you can do. And are you encouraging families in your county to be involved in these things? Are you building a pool of families up so as some families leave and because of other things in their life, do you have other families that can replace them? So the long term would be, are family members aware of the services that exist across all your systems? So do they know what services are out there? Do they know who provides services around children and youth services or juvenile justice? Do they know what mental health services or drug and alcohol services, particularly around co-occurring or the dual diagnosis? Do they know what those are? Can they be part of your presentations that you may put on? Are they invited as part of a group that has expertise because they've had personal involvement? And are you thinking about utilizing family members either through your through county data collection? So your group that might collect data, are you using them and having families look at what quality of services exist in your county? So do they have opportunities to provide leadership, support, and advocacy? So where else in your county can family members and young adults sit on committees or advisory boards? Are you holding focus groups or doing special groups so that you can get information out? So those are things that you could think about doing. That if you're now entering systems of care or the PA Care Partnership, are you doing community groups that would help you to explain to the community what's going on and what you're doing, and that you're looking for family members who have expertise in different systems, and asking for them to think about leadership roles or committee roles, or are there advisory boards that they might want to sit on? Do they have, are you providing information in skill building or training to help family members who are still invested in the system because they have children in it? How do they are making informed decisions for their family? So what trainings are designed that you might be providing to providers about certain things? Are you inviting families and community members? Are there informational settings to learn what, say, family-based or MST or high-fidelity wraparound or family group decision-making? Is that community as well? Do they are family members willing to accept the responsibility for having shared responsibility? That's a big thing. We are used to giving input or being asked questions, but when you're asking us to share responsibility, that's a different level of leadership. And, to help us think that process through, are we ready to do that? Are we ready to take the blame when something doesn't work as well as when it does work? Are we willing to accept the accolades for that? Giving input does not mean we have responsibility. So helping families understand what that means. How do other family members in your county learn what's happening? So is there a family org? If there's not, what can be created? Or are there meetings in the community that you can hold so that other family members in your county learn what's happening? And are your family members in leadership driving some of those meetings? Are they bringing the information to those meetings so that they can talk about with other family members? So it's just not a single point of view they're bringing into your leadership, but are they bringing the voices of others? Because when you get to a certain point of leadership, it shouldn't be just your own personal life you're bringing. It should be what you're hearing from others as well. Okay. I think our family. So, do we have a primary decision-making role in county regarding overall well-being? I think I've talked about this a little bit already. Are they giving input about the decisions and what works best, just not for their families but other families? What happens when family doesn't agree with the recommendations? To think these things through. Are your providers making sure all family members are treated the same and their input is given the same weight in the decision making? Again, family organizations are important, or until that's built, then how do you then provide a place where families can come together and members of the leadership team can take information to them, or the family members on your leadership team can take information to them? Okay. So some of the things that we can have provided, or there's things that may not be on this list that you might want. So family member recruitment and retention. So do you need more technical assistance around the difference between involvement and engagement? Do system partners, do they need to think about what do they need to really kind of think about prior to engaging families and bringing them on to a leadership team? Have they talked about it amongst themselves? What are their concerns? Did you write a vision statement without family members? So how do you incorporate them into that? What's the difference between involvement and engagement? And what would your strategies on moving to engagement be? Or transformational leadership roles? Are you having a family event, and are family members included in the planning? Is their voice being utilized in that way? Are they participating? Are they taking responsible roles within that event? How are family involvement, how are they in partnership with youth and system partners? Is every voice, are families as respectful of systems and youth as youth and systems are as respectful as families, respectful towards families? This needs to be a shared leadership with the same goals and values that are agreed on by the entire group. And how do we, some of the trainings we've already provided has been active listening training, so those communication skills. That's very helpful to anyone who wants to be part of leadership and understanding. Goal setting. How do we help each other set goals and objectives and direct our attention and motivation? Roles and responsibilities around boards and committees and the different types of groups that you can have out there where families can enter their voice and learn what leadership is and the roles and responsibilities that you have when you get involved between advisory and governance boards, as well as the different types of styles of meetings that there are that you could be asked to set on. Facilitator training is another one. Like, how do you facilitate meetings and understanding what that is. We also have training around county leadership family member orientation. So specifically for family members, understanding what that means to be on a county leadership team and what the expectations are around shared responsibility. We also have the family member roadmap, which is part of the Team Up for Family. There's also a youth and young adult roadmap that partners with that, and it's really the beginning steps and strategies around the theory of change for family empowerment. And it really goes through what you need to know and why you need to know what kind of things around everything from how systems function to medication and how to think about what should be in your plans and your goals for your family. And then family peer support specialist, which is a new workforce that's entering in Pennsylvania, and it is families with lived experience being trained specifically to provide peer support to other family members who are entering systems. And there's probably questions around that you have. I'd be more than glad to answer.
And thank you, Crystal. And we also have that presentation and PowerPoint on our PA Care Partnership webpage under the County Collaborative area.
Sure. And we can, if anyone has questions, we can, or you can either email me or call me, and I can either connect you with the person that you may be looking for, or just give an overview on where things are at with moving forward with certification and where in the process we're at with that for this workforce.
Well, thank you. Excellent. We'll obviously, if you have any questions about that, you can always enter them in the chat, or we can we'll unmute everybody towards the end, and we can get feedback and thoughts and questions as well. Turn it over to Christina.
Thanks, Crystal. Hi, Mark. So my name is Christina Paternoster, and I am the Program Director for PA Family Alliance for Children's Services. We are a statewide program of Allegheny Family Network. We do serve the entire state of Pennsylvania, so don't let the Allegheny in our name confuse you. Everyone who works at the Allegheny Family Network and PA Family Alliance for Children's Services are family members. And we believe that this lived experience is really an important part of the services that we provide. There's just something a little different when you actually walk the walk 24/7. We were grant funded in September of 2018. I was actually hired November 30th of 2018. So we've been around a really long time now, as you can imagine. And our goal really is to create family-run statewide network, helping families connect to one another, learn how systems work, and then learn how to work within systems. We want to make sure that we help family members be engaged and valued as leaders across the state. And we work to connect families to one another for mentoring and shadowing opportunities. We focus on the activities that families want to bring to their community, because they may be just standalone activities. They may be things like support group or policy work, wherever their interest is. So some of the things that were mentioned before, families sitting on committees, families attending trainings. I can tell you as a family member myself, I was often invited to meetings, and I was interested in going, but it was scary. Now I'm going to sit at a table and be asked my opinion to speak for the families across the entire county. And maybe some of the things that I wanted to share might be a little controversial, and I worried about what kind of reception I would get in terms of my own family. So families need to be encouraged with one another to get involved, to be supported. One of the ways that we could help is really gather those families that you are asking to be on committees. We can work with them across the state to create a cohort of families who are on system of care committees and work groups, and work together with them so that they could get, whether it's online or in person, we can get together and we could say, geez, what are you supposed to talk about when you go to a meeting? How do I prepare for a meeting? What kind of information do they really want to hear from me? And what kind of information should I be giving them? You only know what happens in your county, and you may only have one or two active and engaged families, and they really may not connect to one another. So what we can provide is that opportunity for families to be supported by one another as they go through this process, and learn more about being on a committee, and how do I attend a conference? What are my obligations? What should I be doing? How do I network with other families? It's a little awkward to walk up to people and be like, hi, my son has behavior difficulties. How about you? And for our system partners, we definitely want to make sure that we help them connect families and work together. So, maybe they need families for focus groups, or they need committee members. So we can help them make sure that their families are welcomed. For instance, if you invite a family member to attend a training, the family member may be the only family member, certainly feels like they're the only family member as they walk into that room. Does someone get up and go over and welcome them and offer to sit with them and make some small chat with them, or some like small talk with them? That's really the difference in feeling welcome, so that you'll come back and feeling like you're part of the group. So we can work with system partners to really have them understand maybe that, what we call with our children the hidden curriculum. We can also work with system partners so that they understand how that works. And as I said in the beginning, we just started in September 2018, so we're getting up and running. Our next slide gives you our website, which is kind of bare bones now, but we're adding to it on a daily basis. Our Facebook group and our LinkedIn group, we'd love to hear from everyone. I would encourage everyone to, if you're interested, sign up for our newsletter, and then we'll be able to keep in touch with you as we get more, have more to offer, and you can let us know how you want to be involved. And I did chat in my email address in the beginning, but I'd really love to hear from everyone. Feel free to reach out and say, wow, it would be really great if you could help families do this or that, or you could reach families. We want to be able to reach out across the state to gather families, so when systems call us, we can say, oh, we have some families in your area we can connect you with. So by all means, let us know what your needs are.
Great, thank you. And with that, I know that one of our always long-term requests is kind of where are the resources at, and where do we find youth and family members or support groups. So we have, I think that'll be really part of the alliance as well. But then we've also worked in partnership with the Pennsylvania Families Incorporated, and I will put that in the chat in just a second. But that's also kind of where like our system of care page is now, when you look for resources, is actually directly linked over to that resource aggregate as an option. And we're really always trying to figure out one of the better ways to capture and show family resources. Because it's a challenge, and things are always changing. So trying to get things that are both accurate and not overwhelming is an ongoing. It's a good ongoing goal to try to achieve. So with that, I will unmute the audience, hopefully, and if there is any kind of questions or thoughts or even specific needs for the trainings, you can obviously also put them in the chat box as well. But just from the group, if there was anything specific on either your thoughts on some county needs or requests for family support, some training, even future training options. Get here in the chat. I will do that. Oh, and Wendy, thank you. There's also the roadmap. It also has an online version as well now. And to the ARC of Lehigh and Lebanon County, Lehigh and Northampton County Advocacy Department hosts a monthly free community training that many family members attend. They survey their interests at the end of each event and use that feedback to build our training calendar, and also offer advocacy lines and email where parents can ask questions, and then other community events and social media. and they would love to connect with PFX. So we'll definitely get you all connected. We've also had from the partnership with our Facebook, we've had some real strong success in making some new connections that way. Even using the kind of paid promotion piece, it doesn't cost a lot of money, but you can actually reach all new groups, and we've actually had some good success with that.
Bye, Carol.
Any other questions or comments or thoughts on training needs?
Hi, Mark. This is Wendy.
Hi, Wendy.
So I'm wondering when Pennsylvania Families Alliance for Children's Services is going to start. Are you guys going to start traveling through Pennsylvania and visiting counties and maybe regional directors of managed care organizations and other groups like that?
Hey, Wendy, thanks for asking. We're working on a plan right now so that we could find the best way to make sure that we can have some personal touches with everyone throughout the county. So we've been invited to a lot of activities scheduled to come out to you in September. So we're definitely making a plan to make sure that we reach everyone in the county or across the state to make sure that we make those personal touches. But we're always looking for invitations.
Okay, and I know it's hard because we haven't had a real, vivacious and lively family network for the last, 10 years or so. But I'm just thinking, there's like Governor Wolf and other people do listening tours, and I'm wondering if you're going to be in a county anyway, and you know somebody, like I would know somebody in Berks County, maybe there's a group that you could go have a conversation with while you're here anyway.
Sure, that's a great idea. We'd love to do that.
So let me know when you're coming to Berks, and I guess if you could make your schedule sort of available to some of us who are your cheerleaders, we'll try to get some families to meet with you too, because I think that's going to be the incentive as we start to change things, to give families a chance, as you and Crystal were talking about, to gather together and support each other. So let us know. We're excited to have you in the state traveling around.
Well, we're excited to meet everyone.
Yeah, everybody that's on the call, that roadmap is such a good training, and I know, Crystal and other people will come out to where you are and train a small group of families where they can do it online. That's another good way to start to build that leadership capacity in families.
Thank you, Wendy.
You're welcome.
Yeah, so there was a comment about one of the things was helping to educate different groups. One example was given, I think, parent to parent, which is out of NAMI, that they might not always understand what system of care is and kind of how to educate these more statewide organizations on system of care. And I think I think that has been a challenge. I think and one of the challenges is when you have multiple different system of care grants around the Commonwealth, describing what system of care is can be really difficult, because if you ever see the first page of the big primal and system of care, it says basically the first line of it is system of care is what you want it to be, which is not the greatest way to always describe something. But I think it's a real good point about helping to provide some additional education to some of the parent organizations, and maybe there's other ways to frame it in really, instead of kind of using the whole this is system of care and this is what it is, because it's different. Maybe there's ways to frame it in looking at the system of care values, and how the system of care values are very similar and ingrained in many of the counties that we're working with, and how that's also part of our long-term history of CAS. But yes, I think that there can be some real good opportunities there, because I think if we can all start speaking some more common language, it can always help. Help us understand kind of what's happening in our communities. And I know if anybody's seeing in the chat, there's also another comment on that is looking for if there's any people interested in providing respite out in the Chester, Delaware, Bucks County. Family Child Focus is looking for providers, as well as they offer the service, and they put in their web page with information there. I'm hoping people can still hear me. I hear lost audio.
I can hear you, Mark.
Okay. All right. Yep, and so at least the philosophy of system of care. Yeah. Okay. Any other comments or thoughts? Okay. Again, here's the email addresses. You can with Christina and Crystal. Crystal is one of our organizers, along with Diana Brocious, on scheduling the family roadmap, and that we are able to provide that through some grant funding through the PA Care Partnership. And then there's also Youth Move PA, which offers the Young Adult Roadmap, which is similar but not identical, but very close to the Family Roadmap. And we've had some real good success with both of them. And then we're excited about the opportunities that are coming our way with the PA Family Alliance for Children's Services. It was really great to see this kind of get off the ground, because it started off with a great, strong collaborative approach. So we were real happy with that. All right. So not hearing anybody else, and I see people kind of clocking off, I will kind of close the meeting down. And again, we'll have this posted up on our PA Care website, which is www.pacarepartnership.org, and we'll have this posted in the next few days. Let's see, one more comment. And other family members join the monthly call. Deb, what monthly call? Is it the monthly call for the system of care one? Absolutely. So we actually did share this on our listserv, which actually got this out to a lot more people. All right. Well, thank you. Everybody have a great day.